A looming shadow, the silent rise of viral hepatitis. Viral hepatitis cases are surging globally, painting a concerning picture for public health. Millions live with chronic viral hepatitis, unaware of the ticking time bomb within their bodies. Untreated, it can lead to severe liver damage, including cirrhosis and liver cancer. The liver, a vital organ, is severely compromised by these viral attacks. The silent nature of the infection allows it to spread undetected, further exacerbating the problem. This hidden epidemic highlights the urgent need for increased awareness, testing, and access to treatment. Decoding the enemy. Understanding viral hepatitis. Viral hepatitis encompasses several distinct types, each caused by a different virus. The most common types are hepatitis A, B, C, D, and E, each with its own characteristics and modes of transmission. Hepatitis A is typically transmitted through contaminated food and water, often associated with poor sanitation. Hepatitis B and C are primarily spread through contact with infected blood or bodily fluids. Chronic hepatitis, particularly with hepatitis B and C, can lead to progressive liver damage, cirrhosis, and liver cancer. Liver cirrhosis can lead to a cascade of health problems, including fluid buildup in the abdomen, jaundice, and an increased risk of liver failure. The alphabet of hepatitis, exploring types A, B, C, and D. Hepatitis. A is often a short-term illness, typically resolving without long-term complications. Proper hand washing and sanitation practices are crucial for preventing hepatitis A infection. Hepatitis B is a more serious threat, capable of causing chronic infection and long-term liver damage. Hepatitis C is a major cause of chronic liver disease, often leading to cirrhosis and liver cancer if left untreated. Hepatitis D, also known as delta hepatitis, only occurs in individuals already infected with hepatitis B. Preventing hepatitis B infection through vaccination is the most effective way to prevent hepatitis D as well. Section 4. Who's at risk? Mapping the demographics of vulnerability. Younger populations, particularly in regions with limited access to vaccination and safe healthcare practices, are at increased risk. Individuals who inject drugs are at high risk of acquiring hepatitis B and C due to the sharing of contaminated needles. People living with HIV are also at increased risk of co-infection with viral hepatitis, particularly hepatitis B and C. Integrated testing and treatment for both HIV and viral hepatitis are crucial for improving outcomes in this population. Healthcare workers are also at risk of occupational exposure to viral hepatitis through contact with infected blood or bodily fluids. Implementing strict infection control measures, including the use of personal protective equipment and safe injection practices, is essential for protecting healthcare workers and preventing transmission within healthcare settings. Section 5. Silent suffering. Recognizing the symptoms of viral hepatitis. Viral hepatitis is often insidious, presenting with few or no symptoms in its early stages. Recognizing the potential symptoms is crucial for prompting individuals to seek medical attention. When symptoms do occur, they can resemble those of the flu, including fatigue, nausea, abdominal pain, and jaundice. The absence of noticeable symptoms in many cases contributes to the silent spread of viral hepatitis. Individuals may unknowingly transmit the infection to others, perpetuating the cycle of transmission within communities. This highlights the importance of routine screening and testing, especially for those at increased risk. Early diagnosis is crucial for preventing long-term liver damage and improving treatment outcomes. Section 6. Breaking the chain. Understanding transmission and prevention. Understanding the various transmission routes of viral hepatitis is paramount for implementing effective prevention strategies. Hepatitis A and E are primarily transmitted through the fecal-oral route, meaning ingestion of contaminated food or water. Practicing good hygiene, including thorough hand washing after using the restroom and before preparing food, is essential for preventing these infections. Hepatitis B, C, and D are primarily transmitted through contact with infected blood or bodily fluids. Avoiding sharing needles or other drug paraphernalia is paramount for preventing transmission among people who inject drugs. Vaccination is a powerful tool in preventing viral hepatitis, with safe and effective vaccines available for hepatitis A and B.